Hey therapists, Rebecca Case here, coming to you as a licensed clinical social worker, EMDR trainer and consultant. So I got a tip for you about working with complex PTSD, complex trauma in your counseling practice. So one of my favorite mantras and guiding principles when I'm working with complex cases is process what's possible. In EMDR basic training, we learn a comprehensive approach to processing targets with clients. This involves a three-pronged protocol in which we identify present-day issues, we float it back, and we work our way forward through the past, present, and future prong. For a lot of our clients with complex PTSD, that comprehensive approach is just too much for their nervous system to tolerate. So this is where you might think about processing what's possible based on the resiliency and the level of stability and the level of readiness your client has in their life and within their nervous system. What might be possible to start with and processing to help stabilize, increase their stability, increase or expand the window of tolerance, and then you can reevaluate what might be possible to process next. So for example, if you have a client who you've identified, or your client's even saying, I can't process my past trauma, like we're just not ready to do that, but maybe they're struggling with present day intrusive symptoms like really intrusive imagery or flashbacks or symptoms of panic attack, or it could even be nightmares or even a thought. You could start by just trying to process in a constricted way that intrusive image, the nightmare, the bothersome thought, or the symptoms of panic. And in doing so, that may help to increase stability, widen the window of tolerance, and open doorways for new avenues to process with EMDR therapy. The ways you would process some of those more intrusive symptoms, if you're trying to just process what's possible and increase stability, would be using the EMDR techniques of EMD and EMD(r). These are both known as constricted processing techniques, or sometimes referred to as telescopic processing techniques, in which we try and just focus on processing a part of the experience, a small part or a moderate chunk of the experience, without activating the entire memory network. This can be a really nice way to titrate the work and start with what's possible for your client's nervous system to tolerate. If you want to learn more about constricted processing, what EMD is, what EMD(r) is, check out my upcoming complex PTSD toolkit training that will be live in August with RebeccaCase.com. You can find it at RebeccaCase.com. Check out the calendar there to sign up. You can also catch it on demand, so it'll be available for 3 months after the live date in August. So check it out. I'll teach you lots and lots of tips and tools that I found to be really useful and important in my work with complex PTSD. And the whole training is going to focus on learning how to process what's possible. I'll see you there.